If you were to ask me what plagues humanity, the number one thing, it's faulty programming. And, most humans' programming is 90% complete by the age of 7, 8, 9 years of age. Mm-hmm. And it's just learned and is taught to them.
Right.
And a person spends the rest of their life trying to unlearn that. And it's unfortunately years of suffering. It's unnecessary. So if we can change our programming, and we can at any stage of life, that's good. It's even better if we can do that for our children.
Welcome back to the Dr. Crockett Show. Today is a really special episode with my very good friend and medical correspondent, Dr. Reed Miloy, who is an internist in Crowville, Texas. If you missed it, go back and check out part 1 of Microbiome Magic. We had such a great interview about this topic, and there was so much to discuss that we decided to break it up into 2 parts. And this is part 2. Part 2 will make a whole lot more sense if you go back and read part 1 or watch part 1. Again, as always, thank you for listening. Make sure to like, subscribe, and share with your friends who may find this information helpful. Have a great day. And without further ado, Dr. Reed Miloy and myself on gut microbiome. So we've got 3 R's so far. We have remove.
Yep. We've got so far we've removed.
We replaced.
We've replaced.
And then we've re-inoculated.
We've re-inoculated.
What's the 4th one?
And that would be repair.
Repair.
Okay, so we want to repair or replenish. Okay. And so repair, we're trying to help those enterocytes, the epithelial cells that line the GI tract, help them to repair themselves. And the fiber, we talked about 25 to 30 grams per day.
Yep.
L-glutamine is they just love glutamine. Those cells just eat it up.
And you can buy L-glutamine?
You can.
Okay.
You can. But you should know why. We don't want people just to go out there and start downing,
Can you eat it in something else, like food?
Well, typically I dose it in a product, either a powder or a capsule. And yes, it can come in, foods.
Okay.
So fiber, L-glutamine, omega-3s.
Okay.
The microbiome loves to have its omega-3s, so that's important. Polyphenols. Polyphenols are things that we find in things like grapeseed extract and green tea. Okay. The polyphenols there. Pomegranate extract. You can literally, part of the protocol I use for my patients who are low on akkermansia, it's not just giving them akkermansia, but also giving them polyphenols to support that akkermansia, because akkermansia loves polyphenols.
And those are plant-based kind of medicinal
All of those
things.
Are plant-based foods. Yeah. And then zinc. And a lot of people are getting zinc in a multivitamin, but getting 30 milligrams a day is a very reasonable thing to do.
Okay. Cool. Okay.
And then there's a host of other things that you can do there. But those are some of the core things to help repair. And there's products out there that help support the GI tract as well. So
cool.
Experienced practitioner could help somebody with that.
Okay. So that's 4. What's 5? Come on, you're killing me.
5
suspense.
is rebalance. And this gets back to what we've talked about before, is living a balanced life, getting the appropriate amount of exercise and sleep, mental health, and nutrition.
There you go.
All right. Want to take care of those 4 pillars of health.
The 4 legs of the table.
And the 4 legs of the table of health, because without those, you're just kidding yourself. Somebody's out chasing around for the latest wild berry from the Amazon basin, or, some strange elixir. I mean, those shortcuts, they just simply don't work.
If you don't have the 4 basics to begin with, then all of this other stuff
you're kidding yourself. It's like shooting a BB gun at a charging African bull elephant. It's just not going to work.
Okay, and so we talked about the inoculation thing already. The stool transplants, which I think are so fascinating. The twin study that they did on Netflix. The thing I wanted to mention about that was how quickly the gut is willing to heal itself.
Yeah.
So, our gut turns over, all of our cells in our body are turning over all the time. Like, I think a skeleton, you get a new skeleton every 10 years or something like that.
Every 10 years, that's right.
And then things like skin and hair and nails are much faster, but so is gut.
Yep.
So the study that the Netflix twin study did, the one that's called You Are What You Eat, they did an 8-week study and they were able to see astonishing laboratory and physical fitness results in people in 8 weeks in this twin study. And I think that when you talk about making changes about replenishing gut and feeling better, I think it's much, much shorter than that. I think within days you can start feeling better, and within 2 weeks you can start seeing healing of the gut lining.
Absolutely. Absolutely. It's amazing. When I sit down with patients and I go over their test results and we're able to show them what's actually happening inside their GI tract, and they can now see it, and it's no longer a ghost. And then you come up with a treatment plan and you go watch these folks execute the treatment plan, which is really easy, really very quickly. They tend to turn things around. Now, it depends on the condition. Yeast can take a while to get rid of. But it can take up to 6 months or even longer to fully repair a microbiome, sometimes up to a year, we think. So, but if you have the good habits and if you're putting if you're feeding the microbiome like you were feeding the rest of your body, then all of a sudden you get this incredible synergy. Things start to get better quickly.
Yep. Yeah, I think that's really encouraging because, it's one thing to hear, it takes 6 months or a year to get it right. But, but I don't want you guys to be discouraged. You'll feel better after eating one whole food plant-based diet. You'll feel it. But the additive effects of that multiply really exponentially very quickly.
And there are people that when they try to eat healthy, eat a whole food plant-based diet, their belly flares up, and almost invariably, I suspect that these folks have imbalance.
So they've got the overgrowth.
They may have the overgrowth, the SIBO.
Yeah, I've run into a couple of people like that. Most people, though, feel better when they start shifting it. The other thing I want to ask you about is aging. So what changes in the gut microbiome, specifically with menopause? Because that's a huge part of my listening viewership. But also I've had people tell me, my older geriatric patients tell me that their gut doesn't work the way it used to when they're in their 70s and 80s. So what happens, and is that inevitable?
Well, I don't think we fully understand. We don't know the whole answer to that question, but I think we're beginning to learn some important things. Number one.
Stay tuned. Listen to us in 5 more years. We'll have an answer for you.
We'll be back in a decade. Don't go anywhere. No, I mean, we talked about hypochlorhydria, which is low acid environment, right? And as we get older, that, the stomach, like everything else, may be struggling to make adequate amount of acid and keep the pH. Once again, a lot of people on those chronic proton pump inhibitors that suppress acid, pancreatic insufficiency. The pancreas is no different. So as we age, all of these things are coming into play, and they're affecting how the microbiome is functioning. Now, my fundamental belief at this stage of my career, from what I've seen over the years, is that it is lifestyle. And, we talk about, feeding the microbiome. Well, we could say we want to feed it what? Not just these healthy foods that we're talking about, but we also want to feed it exercise. So there's more evidence starting to come out. Athletes have healthier microbiome. So exercise, and then, if we're not getting adequate sleep, we're going to have chronically elevated cortisol levels. And so that's a stress hormone, and that's going to affect immunity, and that can get you into trouble there, right?
Yeah.
And a lot of women who go through menopause are having sleep disturbance. This is a big problem that a lot of primary care physicians struggle with treating with their patients.
Well, and it's interesting because the primary reason for that initially is estrogen drops, and then you get hot flashes, and the hot flashes disrupt the sleeping pattern. So bioidentical hormone replacement therapy, or body neutral hormone replacement therapy, it can help that a lot. But even in women that have hormone replacement therapy, I still see a huge portion of my patient population with sleep difficulties. And one of the primary patterns that I see is they'll sleep until like 2 or 3 o'clock in the morning and then be wide awake. And I did my own testing. I put a CGM monitor, a little continuous glucose monitor on. And I watched what was happening to myself at that 3 o'clock in the morning thing. And my glucose levels started going up. And it wasn't because I was eating, because I was asleep. It's a cortisol rise. And so I've been like, just playing with that a little bit. But the thing I always tell my patients about that is don't get up, don't turn on your blue light, your blue screen. Just lay there and let your brain do what it's going to do and let your body repair and rest. And usually you'll fall back asleep. And even if you don't, your body's needing that rest time to repair. That's what the body's doing during sleep. And if you just get up because your brain says it's time to get up and it's 3 o'clock in the morning, you're shortcutting your liver and your whatever else from being able to repair. So should not get up. Don't look at your phone. Don't look at your blue TV screen, computer. If you have to look at something, read something white, like your magazine or your book, an actual piece of paper. And figure out what's going on with the cortisol level, right? So this is going to segue into the next part of our conversation, I think, on a couple levels. So one, I want to talk about stress levels and cortisol, but I also want to talk about that little thing I just touched on with the mind and watching what's going on with the mind. So,
yeah, that's a really key point. The anxious mind will wake up in the middle of the night.
Yeah.
And once again, just as a reminder, we want to think of the mind as the software of our brain. Okay. The brain is hardware, and it's malleable hardware, right? Through neuroplasticity, but the mind is the programming. And if you were to ask me what plagues humanity, the number one thing, it's faulty programming. And most humans' programming is 90% complete by the age of 7, 8, 9 years of age. And it's just learned and is taught to them.
Right.
And a person spends the rest of their life trying to unlearn that. And it's unfortunately years of suffering. It's unnecessary. So if we can change our programming, and we can at any stage of life, that's good. It's even better if we can do that for our children.
Yeah.
And so anxiety, sleep disturbance play a big role. Women going through hormones, there's a whole host of things that are going on there. And we need to get better at it. We need to get better at helping women through that transition. And people like yourself who are recognizing this and helping their patients is really where the rubber hits the road, because nobody else is going to do it. It's up to the patients and the MDs and other practitioners to step up to the plate and start asking our patients, how are you sleeping?
Yes.
That's part of my annual exam with my patients as one, because we go through the table of health questions, and it's just it's just right up there at the top.
And you know why we don't like to ask it? Because we don't know what to do about it. Like, I don't want to ask a question and then have them say, Doc, I'm sleeping terrible. And I'm like, well, I'm a surgeon. Go see somebody else about that.
Go see Dr. Miloy.
Go see Dr. Miloy. No, I do talk to my patients about these things. And that's kind of the basis for the show is we're taking the conversations about all the stuff that's aside from the surgery part and putting it on the show here.
Yeah, absolutely. And not to kind of derail the conversation too much, but you take care of the table, you're going to sleep better. In other words, if you get that aerobic exercise 30 minutes a day, and that's going to help. Probably the most underrated thing is to get natural sunlight within the first hour upon awakening. 20 minutes of natural sunlight exposure. It doesn't have to be outside. It can be through a window. That's really, really important.
And I use a sun lamp during these dark days I have in the past. So, one of the shows I'm doing soon, it's going up, I don't have a date yet, is about morning routines. And we're going to do your little segment about what you eat. And I'm going to throw in some of the stuff like the exercise in the sun in the morning and all that. Plus kind of my own routine in the morning. Ollie's routine in the morning. Yes. Ollie's routine too. Yes. We sit and drink coffee together, don't we, doggy? Yes. And you get your cookies. Yes. So we're going to do that. But, sorry, back to what you were saying. So So talking about the table of the health. So you're not going to sleep well if you're not doing your exercise, eating well, managing your stress.
And caffeine is a big deal. For most people, it has a half-life of 4 to 6 hours. So if you're going to drink or consume caffeine, you want to do that in the morning.
Yep.
And avoid it,
after 3 o'clock.
Once you get past the noon hour.
Yeah, I don't drink it after the morning.
And there's some folks, they're super sensitive or slow metabolizers. And so it can take, quite a bit of time for them to clear it out completely. And of course, if you're stressed and anxious and you're putting a stimulant into your body, that could work against you as well.
I have a funny story about a friend of mine. That has to do with that. Yeah. She came into my office. Yeah, that's how we met. And she was going through some, challenges. And she comes in with all of these health meds, like big old bag of like all her vitamins that she's doing because she's really healthy, right? And she's gone and done her research and bought all these vitamins. And she's like, I don't know what's wrong with me. And, she's transitioning through menopause and all this other stuff. Oh, I'm so anxious. I can't sleep. She's just kind of breaking down. And she takes like 60 bottles out and lays them out on the exam table. And I'm like, you know what? I'm not a naturopath. I know a little bit about these herb things, but like that is not my wheelhouse. I'm like, okay, I'll sit and go through them. So I started sorting them out. And there was like a pile on this side and another pile, like half and half. And I like put my hands down and I went, okay. You see all these over here? These are stimulants.
Yeah, that's from.
She was on a bunch of stimulants like green tea and things that had caffeine in them that were hidden. And she was having a lot of trouble from that. So we decided to kind of modify her vitamins and stuff a little bit. She started feeling a whole lot better. So I guess my point there, other than that just being a fun story, is we have to talk to people about what hidden stimulants might be in their diet and what they're taking. So
yeah, that's really important. You definitely, for folks listening, I think bringing in your supplements, to review with your care provider is really important. Now, some may be astute and up to date on that sort of thing. Others may not, but it can really work against you. And there can be drug interactions as well with some of these supplements. So we got to be careful with what we're putting into our body. And then don't get me started on the whole quality and safety issue, because that's another problem as well. Yep. There are a lot of great companies out there, though, that are doing good work and making good product.
Well, yeah, one of them is ours. Thank you for that little plug. We have a very small vitamin shop. It's called Virtuosa Vitamins. And we sell vitamins that are manufactured by a company that has FDA approval on all of them. So they're all pharmaceutical grade, FDA approved, not because they have to be, because nutritionals like vitamins don't have to be, but because the company that we choose to buy from for our manufacturing puts everything through FDA. So you know exactly what you're getting, unlike, what you're alluding to, which is what you see on the shelves and just the lack of quality assurance in a lot of those supplements. So I don't want to go too far into it. But
we can take this sleep disturbance thing and tie it back into microbiome and anxiety, for example. About 2/3 of the serotonin that the brain's going to use is going to come from the GI tract.
Yep.
And if we have an unhealthy microbiome, we're going to have trouble with serotonin levels. We're going to be insufficient.
Which makes us anxious.
Absolutely, and depressed and so forth. And so I like to say the standard American diet is this sad diet.
Sad diet, right?
Yeah,
SAD.
for sure.
So a lot of people take medications like SSRIs, serotonin reuptake inhibitors. And the one thing that people don't understand about those medicines, they're great medicines, but if you don't make enough serotonin to be in that little gap between your neurons for it to do the neurotransmission, then you can do all of the reuptake inhibitor medicine in the world. It's not going to work. Yeah,
a lot of them do cause sleep disturbance.
That's true.
They have an effect on the sleep profile. And so they have a place. They definitely have their place. But if you look at things that can be done naturally, I would say fixing the microbiome will take time, and that's very important for just your whole body health.
Right.
But immediate impact is aerobic exercise. And that's, study was done back in the 90s comparing a very good and I would say, very good SSRI called sertraline. And sertraline, I like it a lot because it does have a very little disturbance of the sleep profile, but it can cause diarrhea in a lot of people. So there goes your microbiome business.
You fix one thing, break another.
That's the way it is in medicine. We got to be careful. But the exercise worked just as well for depression and anxiety as the sertraline did.
I know, that's stunning, right?
And it really shows you the impact of, what you can do if you take care of business with your table of health.
Yep.
You can heal yourself without. I think today more than ever, folks want to take less pills.
Yeah, I see that. And definitely in my younger patients too. Like my kids' generation is much more aware that my kids are in their 20s, and their generation is way, way more dialed into nutrition and health and eating than we were.
Much more sophisticated. They got YouTube. And so
I know they have all the information. Yeah.
They're out there, absorbing this information. They're also looking at what happened to their parents and grandparents.
Yeah.
And they're saying, I don't want to be that.
I'm not going to be that. Okay. Let's talk a little bit. Let's transition from sleep and cortisol to the next question that follows, which is, patients want to know how to reduce their stress levels. And one thing that comes up a lot in our practice is about meditation and how to meditate, and what that is, what it isn't. What do you tell people about that when that comes up, and what role does that play in your practice in stress management?
Well, it's really become a lot more popular. Thank goodness. It's a tool,
right?
Is how we can look at meditation. It's a tool, and it's a tool that helps to create separation between the limbic system of the brain, which is responsible for emotions and behavior.
So we call that the lizard brain.
Yeah. And so it helps create separation from the limbic system and the prefrontal cortex, where the executive functioning and thinking and processing is taking place.
Right.
And the thing that really gets most human beings, it makes them suffer the most, is they're under command and control of the limbic system.
Right.
And there's not enough space being created between their processing thinking mind, the prefrontal cortex, and the limbic system.
Right.
And so what meditation helps a person do is to create that space. There's a lot of other practices that can do that as well. But meditation is a wonderful habit to develop. And the best time to do that, of course, is in the morning, because you're going to have probably a stressful day. You go out into the world. Yeah. It's always one damn thing after another, don't you know?
It is.
Yeah. So we have to prepare for it.
So there are a couple of ways that I teach my patients to think about this limbic system and the prefrontal cortex thing. So I call the limbic system the lizard brain. That's because that's like our base fight or flight, basic reaction kind of thing. And then the prefrontal cortex, of course, is our higher brain of doing what we want to do. The one tool that we teach in the coaching circles that I run in is the limbic system is the toddler in the back seat of the car. And then the prefrontal cortex is the mom in the front seat of the parent.
Great analogy.
Because you can feel your body kind of like starting to panic or pitch that tantrum or whatever. And often if you're aware of that that's just a reaction, you can feel it in your body, then you can take a second, just take a beat and think, okay, toddler, you're just doing what you're supposed to do, brain. You're supposed to warn me of things that are scary and bad and keep me safe like they did in caveman times. But, you're okay. And I'm going to make a decision to do X, Y, or Z. Yep. So that's one way that we do it. The other is in that book that's right behind you. I recommend a lot, The Untethered Soul by Michael Sanger. I really like that book because when I first started talking to patients about meditation, we live in the Bible Belt, very Christian fundamentalism type. Well, not everybody's a fundamentalist, but very, very devout Christian population. And there's been a lot of misinformation within that whole religious scene about what meditation is and what it's not. Meditation is actually a form of prayer. It's what we do, and we do contemplative prayer.
I was about to jump in and say, hey, Christians have been doing this for eons.
Yeah, prayer.
And so prayer is a way of focusing intention.
And beads, when people are doing the rosary, that's a form of mantra, or it's just helping to focus the mind. The thing that Michael Singer says in his book that I like so much is he talks about the analogy of sitting in a movie theater, where you're sitting in a chair and you're watching the movie and you get completely absorbed in it. You forget that you're in the chair. You don't feel it. You're in the movie and being part of it. But then you can step back out of it and realize, oh, I'm in the chair and I'm watching the movie. And then you're becoming the watcher of the movie instead of being the one in it.
Yes.
And so we teach our patients also to become the watcher of their brain, and being able to meditate doesn't necessarily mean you turn the movie off. It just doesn't work that way. We so often think that it means you have to turn your brain off.
That's a key point. A lot of my patients say, well, Doc, I tried to meditate and then it was just chaos.
Yeah.
Good. That's all. The meditation is just watch initially for a lot of beginners is just watching the noise in the brain and just observing it. Just, saying to yourself, my gosh, my mind is just full of mental noise today.
Yeah.
And that will take the noise down a notch.
Yeah.
And that makes a difference.
It does. So what that does to us physiologically is it decreases our adrenaline levels, which decreases the constriction of our blood vessels. It allows our heart rate to slow down, blood and oxygen to get to your brain so you can actually think. But it actually can help you drop your cortisol levels too.
Absolutely. So the limbic system is going to just go right over to the thalamus, hypothalamus, and boom, all of that's going to interact with the endocrine system through the adrenal glands and so forth, and the autonomic nervous system. And all those cardiovascular benefits you just mentioned, but we should also talk about the effects on the brain.
Okay.
Because we now know that for every major episode of depression or anxiety that a person has in their lifetime, there's a 13% increase in risk of dementia later in life. So a person in their 20s and 30s and 40s who's going through a lot of stress or depression, there is damage. There are hits being taken by the CNS, central nervous system, the brain.
Wow.
And this is, a big concern, of course, because we got all the other things that are going on with the public's health, metabolic syndrome, obesity, and that's affecting cognitive health as well. So, and then immune function plays a big role. We're talking about the microbiome, and that last step is we want to get the stress out. We want to rebalance. Okay, how do you do that? Through exercise, through sleep, through mental health, and I put meditation under that mental health leg.
Yeah.
But you can meditate. I mean, meditation, there's a whole variety of different ways to meditate out there. Runners, long distance athletes, triathletes, they'll talk about just turning off the mind and going into a quiet, still place, a state inside of themselves.
Yep.
And so you don't have to be sitting still to do this. You can actually be moving the body. But for most of us, a meditation practice is going to, and we need something that's actionable. It's got to be doable. This is great, but it's so, I don't know where to start, so the easiest place to start is in the morning when you first wake up, before you turn on any lights, before you start making yourself beautiful for the day, is to sit still. What I like to do, I get at the foot of the bed, get into Indian style kind of, cross leg is like a kid, back straight, and I'm just going to focus on my breath. I'll take 2 deep breaths. I call it a 4-2-6 breath. I'll inhale through the nostrils to a count of 4. It's a belly breath coming from down below, and I'll hold it for 2 seconds and then exhale through the mouth completely for 6 seconds. I'll do 2 of those. Now, what's happening there And matter of fact, you can do this any time of the day, but I'm resetting my autonomic nervous system.
That's your flight or fight versus your relaxation, sympathetic versus parasympathetic.
You have two branches. You have sympathetic, parasympathetic.
And it doesn't mean sympathetic like I have sympathy for you.
No. Sympathetic is fight or flight, right? And most people are walking around out of balance. And this is raising blood pressure, raising heart rate, raising stress, anxiety levels. I mean, just wreaking havoc on our health. And parasympathetic is the pina colada on the beach, right? And so when you take a couple of big deep breaths, you get this, and it happens within seconds.
Yep.
We had a very expensive $70,000 device that I bought 15 years ago, and we did thousands of studies, and we could just watch people go shh, and just a couple of deep breaths.
Do you remember when you made me do that? Like, it was a year ago, almost to the day. I don't remember the exact day we did the first filming together here, but it was when we were still developing the studio, and you were kind enough to come and be my guinea pig guru. But you remember I was so wound up that day. I was dealing with the tech, and you and I had never met in person before, and I had all the food, and the stuff wasn't working, and you were like, would you just go lay down and take a breath?
Came back like a new person, right?
I did.
10 minutes, right?
10 minutes. I went and laid down and meditated for a little bit and then came back. It was like, okay, let's do this.
Complete reset, right?
Yeah. So I do it at work too.
Yeah. So most people are running around in their life like this, completely imbalanced. And this is causing all sorts of problems. We now know that this is a risk factor, a major risk factor for having a heart attack or stroke. And I'm sure there's a lot of other things that will probably go into that category. I'm sure we'll find things like malignancies and disturbance of the microbiome, of course, and then dementia. Yeah, right. It's not stress it kills, right? That's the old saying. And now we know why. And some of those patients that we had them take a deep breath, guess what happened?
Nothing.
Now this means there's been damage to the parasympathetic branch of the autonomic nervous system. The sympathetic is a much more robust component of the autonomic nervous system because we basically evolved in an eat or be eat world.
Right.
You know, you had to be able to react to a threat just instantaneously. So that is more robust and can withstand the diabetes and the high blood pressure longer. Now, just to let everybody know, it's diabetes, high blood pressure, and these other conditions, smoking and so forth, that are causing damage to the autonomic nervous system. All right. The whole body's being damaged. So it's not a surprise that the autonomic nervous system is affected. With these people, we put them on 150 minutes per week aerobic exercise, zone 2. Which is easy.
Being able to talk while you're walking.
Just can speak a full sentence. That's a good proxy for zone 2. And over a 6-week period, a lot of almost everybody improved. Not everybody got back to normal, but most people improved and other parameters improved, of course.
You know what else helps? Bioidentical progesterone.
Yes.
So in the old days when we dosed estrogen and progesterone for menopausal women, we only gave them progesterone if they still had a uterus because we were just trying to protect the estrogen from causing endometrial cancer. And that's all we thought the progesterone was good for. And now what we've discovered is if you use the actual bioidentical one, we call it the Zen hormone in our practice. It's very it'll help with sleep. And
I was about to say sleep. Yep.
It dilates the blood vessels, decreases stress levels, cortisol levels. Yeah.
Probably what did more damage to women's health in this country, and I saw it at the moment it wasn't at the moment the study was published, but it was like a week later. The Women's Health Initiative study that was published
in 2002.
And I can point to a handful of things, probably 5 things in my career that were just like, what? We are going way off course here.
Yeah.
And that was clearly one of them. It has caused immense harm to women.
Yeah. So just for our audience, because this is a big topic I was not prepared to get into this today. So that's true. There were a lot of misnomers from that, and a lot of the things that that came out of that study that influenced how we dealt with menopause and hormone replacement therapy now has been debunked and reversed.
Correct.
For instance, one of the things in it was limiting the length of time that a woman should be on a hormone replacement therapy. So now with the bioidentical newer generation, there's not that 10-year time limit where they have to stop it after so long, because the risk of heart attack and stroke that was shown in the WHO study with that was done on non-bioidentical hormones. And the other big one that I heard was the breast cancer thing. So
that's right. The breast cancer incidence was very low, actually. When you looked at those overall numbers, I think there was like 8 extra cases
and
or something. It was
actually the Provera that was causing the increase. It wasn't the estrogen, even the horsemare estrogen that they were using. So there is an organization called NAMS, the North American Menopausal Society, that put out a statement in 2002 and 2023, a statement in 22 about the update for guidelines for hormone replacement therapy for women. And then last year they put out one for the non-hormonal replacement guides. And so we'll put a link for the NAMS articles there below.
Yeah, very important.
Yeah.
I saw that actually. And I was like, wow, finally, course correction. It took us 20 years.
Yeah. And it's cost lots of lives, because we're finding out being able to stay on bioidentical estrogens actually continuing to reduce cardiovascular risk as we stay on it longer. And that's just the total.
And just listen, a woman's had this for decades, right? And now all of a sudden it's gone.
Yeah.
And you have all this just chaos taking place, sleep being disturbed, everything else. Yeah. And this is not, oh, honey, you're having hot flashes. No, this is a serious health issue.
Yep.
And I hope clinicians, if anybody's listening, is addressing this much more aggressively with their patients,
with their providers. Yeah. I think clinicians in my field are picking it up pretty quickly. One doctor that I recommend a whole lot, and I recommend her book, is the Mary Haver. She's in Galveston. She's a OBGYN. I have never met her personally, but I just adore her writing.
Get her on the show.
Yeah, I need her. And Mary can be on the show. It'd be fun. It's her book's The Galveston Diet.
Okay.
Yeah, call me, Dr. Haber. Her book's The Galveston Diet. I think I heard that she's coming out with a menopause book very soon. So maybe I'll save the in-depth dive for when I get her on the show. And if I can't get her on the show, I'll figure something out. But she's a lot of fun to watch. She's very up to date on everything. And she has a menopausal clinic in Galveston. One thing that kind of hurt my feelings was she said she was having patients from San Antonio come down there. And I'm like, hello, we do have good people in San Antonio that know how to do this. But I think what she illustrated was it's hard for patients to find. It's
hard for them to find. It's like if they can find the people locally, they prefer to, of course, stay local.
Yeah.
And there are great clinicians here. Yeah. Maybe that's part of what you can put together.
Yeah.
Is on your site,
or some recommendations. Yeah. Well, and this is something that I am going to say, yes, you can come to my office for this, because I've got amazing nurse practitioners that help do the hormone replacement therapy. And I focus mostly on surgery, but that's a big part of managing our patients. So
sure it is.
And, that's all I'm going to say about that. So yeah, cool. All right. Where were we? What else are we going to talk about? Meditation.
Well, I think, when you get back to meditation, all right, let's just kind of, So I like to, getting back to what I do in the morning is I will, here's what the data shows. So I try to be data driven, evidence based driven when I can be. All right.
Because you give me science, the data, you set it up, I'll hit it and make it make sense.
So the science points the way, right? It's a tool to unveil the truth and get answers. And so 13 minutes a day is all it takes.
Meditation.
13 minutes in the morning.
Yeah.
And, I'm just focusing on this spot between right here, right there between the eyes. I'm just kind of, focused there with my mind. And I'm also just focused on the breath. And then if there's a bunch of noise up there, I'm just watching it bounce around. I'm not trying to control it. I'm just letting it go. Okay. Let the noise go. It's okay. Mm-hmm. And then within about 2-3 minutes, or even less, the more you practice, the faster this happens. The noise just goes, doo.
It does.
And it goes down. And then you kind of start to get into this almost a sensation like you're falling. Okay.
Or
floating. Yeah. It can be floating or falling. Mm-hmm. Some people freak out. Okay.
Really?
Some people have a dissociation with their ego. Okay. And it can be very disturbing. Really? Yeah. And so, if you have that, that's normal too. Okay. You're not going to die. Nothing bad's going to happen. What does that look like? It can be a loss of identity, a sense, it's a flash of losing touch with yourself, because most human beings are over-identified with their ego. It's the unconscious conditioned mind, as Eckhart Tolle likes to say. I think it's the most appropriate brief definition, an effective definition. And in meditation for beginners, they will sometimes, a dissociation from ego will happen, because in the meditative state, the boundaries start to go away between ourselves and everything else. We begin to realize that we're connected to everything, which is the truth. Right. And the ego says, no, I'm about separation. It's all about me, don't you know? So there can be a little bit of anxiety.
So I like to do the drop in the ocean meditation.
Yes.
That's what I do in the middle of the night when I can't sleep, is I'm able to just pretend that I'm a drop of water in the ocean. And sometimes I float on the waves, and sometimes I drop down into the depths of the ocean or get swallowed by a fish, but it's a little bit more creative than what you're talking about the single spot in the mind, but it works for me. And it does put me in that state of ego dissociation, where I'm just like part of everything. And
you're part of the bigger ocean.
I'm just a drop in a gazillion buckets of.
And that's actually an empowering concept.
Yeah.
Because, I'm not this isolated. It's not just me. I'm connected to something vastly more powerful than just my ego.
Well, I think it's a balance, because we don't want to be ego. We don't want to be wholly without ego either. And you and I have talked about this in depth before, but I think I have some new thoughts about it. So I think it's different for men and women.
It probably is on the surface. At the end of the day, we're all affected by our physiology.
Right.
But I think even we get below that, I think, I think it's the same. Yeah. Well, I'll take that. I won't defend that position, but I will say that's what I've observed. That's all I can communicate. It's what I've observed with my patients.
So what I think is that men are conditioned throughout their life to feed the ego and to have a strong ego, and women are conditioned to let go of their ego their whole life and to become disengaged from their ego to the point of codependence. And so when you start talking to people about letting go of ego, when you're talking to a woman who has no sense of self because she's turned it over to a male partner, then that's a very different conversation than when you're having a conversation with the male CEO who is head of the household and then probably needs to let go of it. So I think everything is a balance, but the more I look at those types of dynamics in people, the more I think approaching the ego conversation is different.
It is a fascinating topic. And I would just add to what you're saying is evolution is playing a role here.
Yeah.
A woman, when think about it, when a female is thinking about having intimate relations with male, there's consequences. We call those children.
Yes.
And so the woman is much more invested in that act. And,
True.
you think about how we existed for eons and millions of years as hunter-gatherers. You're not going to make it as a single mom. It's going to be extraordinarily difficult.
Right.
But a clan, a partner, somebody that's there with you and invested in those children.
Yeah.
Yeah. That's a different animal. Now, what does that plays a role on the dynamic of the woman and the relationship with that mate.
Yes. But also the woman gives everything over to take care of her children.
And the woman has got more oxytocin and she's a nurturer.
Yeah.
And the one thing that I have observed is that women, being just natural nurturers, and they're better at it than men.
Yeah.
They neglect their health. Okay. And
that's my whole career, Reed. That's my whole practice.
But if you really dig deeper, if you dig underneath that, even below the surface of that, it's a form of denial and not having to come to grips with their issues and facing their pain. Because there may be a lot of pain there, and it's difficult for us to face into our pain. And the place I see this is in menopausal women, or older, whose kids have flown the nest, and they're still, they're following their children around all over the country, and their children are in their 20s. Right. And it's just like, wait a minute, what's going on here? They've lost themselves in that role.
So then they don't have enough ego of themselves.
And that is ego.
Right.
That's part of the ego. So it's like they're lost in the role playing. And it's an excuse when you dig into it is not dealing with their stuff. There's stuff there that needs to be dealt with.
Well, undoubtedly. Agreed. How did we get down that?
I don't know, but that's a whole nother episode. Not where I
wanted to go with this talk today.
That is a whole nother episode.
But you walk that tightrope of the menopausal aging woman kind of nicely there. Look, I don't make the rules. I'm just a life student. That's all I am. Okay. If you say one thing, what are you? I'm a student of life. I think it would be really interesting for us to have a discussion about the difference of the patient populations in our practices.
Oh, yeah.
Because I do think what you see in your practice is
the patterns are different. They're going to be different.
Yeah. All right. So what I was going to say about the ego and the loss of the ego thing, which is where this all went off the tracks, is I think we need both. I think it's balanced. Like we don't want to completely be without an ego at all. We need to have a sense of self. And
if you look at the ego as best we can understand, we don't understand it completely, but it is a byproduct of evolution. Okay. It is all about not dying. Okay. Rule 1 is don't die. That's the first rule.
Yep.
Number 2 is have some kids, procreate. Okay. Yep. So don't get eaten, don't die, and have some kids. Now, both of those involve, shall we say, some can encourage some unsavory behavior, that we're now becoming more aware of collectively, which is our great step that we're making as a species. We're beginning to see ourselves and this unconscious conditioned mind and how it plays out. So we're all born with this creature.
Yeah.
And it's like, okay, is it all bad? Not bad at all in an eat or be eaten world, and one in which you need to procreate. Well, we've overrun the planet.
Yeah, we have.
And we don't live in an eat or be eaten world anymore. We've changed the world. And so we're fighting our evolution here. And that is a tall order.
Oh, I think we're transforming is what's happening.
We are transforming.
And I think that's the next thing we're going to talk about is transformation and change.